Question to Dr. Marmalis. I'm pulling it from the Q&A session. How long does it take for the resistance to a targeted therapy to occur?
It's a great question. It's very patient specific. And we have some general medians from clinical trials about how long until a patient may have disease progression on certain targeted therapies. But that's just a median. 50% of people have it earlier than that, and 50% have it later. So it can be quick. It could be a matter of months, or it could be years.
Another question that I'm going to pull, thank you. Another question I'm going to pull from the Q&A session, I'm going to address it to Dr. Singhi. When you were talking about resistance to targeted therapy, you mentioned the chemotherapy is one of the options. And the question from the audience we have, can chemo reset the cancer?
Yeah, that's a good question. I typically don't describe chemo as resetting the cancer. What I say is that it's helping to treat the cancer, right? And so I continue to go back to this. We're always trying to do better than chemotherapy. We're trying to be more precise, but sometimes we need chemotherapy to really get that response. It can work quickly, especially for patients that have a transformation to small cell lung cancer, and we know it's effective. So I don't typically say that it resets the cancer. What I say is that it can augment sort of treatment, augment symptom support for patients that are experiencing disease that's causing issues.
I think, by the way, I was going to say, Lyudmila, I was going to say the patients or the audience is asking extremely phenomenal and insightful questions, because I've had this question for the longest time, is that if you take a patient who was doing well on a TKI for 5 months versus one who's doing good for 18 months, and then you offer both of those patients chemo after, will they get the same benefit from the chemo? And we looked at that data actually, and the answer is no. It's the patients, at least from our data set, the patients that did better on the TKI ended up doing better on the chemo. And so who knows what that means? But I mean, the questions are pretty amazing actually today, very insightful.
Yeah, and I think building in what you say in your area of expertise, and I think those patients will also going to do better with radiation, right? So if we take them 2 years to progress,
right,
we know you were talking about the biology of the disease. We know that this is not the same biology as a patient who has, let's say, a primary progression on targeted therapy. So definitely plays into a role.